The lingering depression and anxiety associated with the pandemic.
Clinical depression is a health condition that can affect anyone of any age, including children.
Well, mental health issues are on the rise here in America. Some people go undiagnosed and untreated because they don't want to visit a mental health professional.
Many individuals suffering from depression seek relief through medication. Antidepressants can be life-changing, but for about 1/3 of people with depression, standard treatments do not work. This is where the SAINT protocol comes in, a revolutionary approach for those who have not found relief through traditional methods. SAINT stands for Stanford Accelerated Intelligent Neuromodulation Therapy. It involves a form of repetitive transcranial magnetic stimulation, or RTMS. Unlike traditional RTMS, which applies magnetic pulses to the prefrontal cortex, the SAINT protocol uses advanced imaging to precisely target specific brain regions linked to depression. Here's how it works. First, a detailed MRI scan maps the patient's brain to identify the exact regions associated with depressive symptoms. This allows for highly targeted magnetic stimulation. Once the target areas are identified, the treatment begins. The SAINT protocol administers magnetic pulses at a higher frequency than traditional RTMS. Instead of spreading sessions over several weeks, SAINT compresses the treatment into an intensive 5-day period. Patients undergo multiple sessions each day, with each session lasting around 10 minutes. This high-frequency, high-dose approach has shown remarkable efficacy.
Within days of receiving the treatment, she felt so different that she says she's still getting to know herself. For the first time in her life, Teresa feels like her depression is manageable.
I had more self-confidence I'd ever had in my life. I had more self-esteem I'd ever had in my life. There was nothing I couldn't do. I had never felt that way before in my life, ever.
In recent studies, the SAINT protocol has shown a response rate of over 90%, with 80% of participants achieving remission. These statistics are promising, offering new hope to those who have struggled for years. Let's delve deeper into the science. Depression is linked to dysfunctional neural circuits in the brain. The prefrontal cortex, which is involved in mood regulation, often shows reduced activity in depressed individuals. The SAINT protocol aims to reactivate these areas. The magnetic pulses stimulate neurons, enhancing their activity and connectivity. This increased activity helps reset the brain circuitry, leading to rapid improvements in depressive symptoms. Before treatment, the depressed brain shows low activity in the prefrontal cortex. After SAINT therapy, there's a marked increase in activity corresponding with symptom relief. The SAINT protocol is not just a breakthrough in treating depression, it's a beacon of hope for those who have endured so much. As research continues, there is potential for SAINT to be adapted for other mental health conditions and neurological disorders.
Are you targeting different brain regions?
Yeah, so with OCD, for instance, what we're trying to do is inhibit the brain region that's overactive in OCD. It's a different problem with different brain anatomy, right? And so instead of an area that's underactive, and you hear depressed people say, I just can't do this. And OCD, that's the opposite problem. People are doing like a lot of things, right? They may be washing their hands 100 times a day. They may be checking the stove 100 times a day. And so you actually want to.
As of September 6, 2022, with the FDA approval of the SAINT protocol, this groundbreaking treatment is poised to be readily adopted in clinical settings. Experts predict that within the next 5 years, the SAINT protocol could be available in major mental health clinics across the country, offering new hope for patients with treatment-resistant depression.